Hello, everybody. Welcome to the next episode of Cancer Survivor MD. Today, we are very fortunate to have an author talk with us on her publication day, and I'm going to give it to Brett to introduce our guest.
Thank you, Josie. Today we're talking with Carolyn Roy-Bornstein, who is a pediatrician and writer whose work focuses on the emotional and narrative lives of clinicians. Through her clinical experience and engagement with narrative medicine, she explores how reflection, especially writing, can help the professionals process the complexity, grief, and meaning embedded in their work. She is the author of A Prescription for Burnout, Restorative Writing for Healthcare Professionals, which is the book we're going to be talking with her about today, as well as a couple of other books I should mention also. Through Thick and Thin, One Foster Family's Eating Disorder Journey, and Mother, a Son, and the Journey from Grief to Gratitude. A Prescription for Burnout is, in my mind, a very timely book that reframes burnout not as a personal failure or something to quickly fix, but as a signal of deeper disconnection from purpose, identity, and meaning in medicine. So welcome, Carolyn, to our podcast.
Thank you so much for having me, Brad. Thank you for reaching out.
Yeah, it's my pleasure. It's delightful to be able to interview someone whose book I've just read and whose writing is inspiring me. So I guess I'd like to start with maybe a more personal question, and you can take this in any direction you would like. But, you have a medical career that you bring to this book, life experience, but also you have a family as well. And I'd like to know how either your career or your family motivated you to write this particular book.
Yeah, so thank you for that question. I'm a pediatrician. I have been for over 30 years. I was a registered nurse before that. I worked for 10 years, and kind of my nursing and medical career overlapped for a couple of years in medical school. And the beginnings of this book started with, there were a lot of books on burnout out there, and I think a lot of them come from a research perspective, studying the phenomenon and coming up with solutions that they're offering, or from the perspective of a burnt out physician who is offering their own solutions, what worked for them. My take on it is coming through the lens of writing itself, having helped me at one particularly low point in my life, which was, we have to go back 20 years now, when my youngest son was hit by a drunk driver and his girlfriend was killed, and he was left with a serious traumatic brain injury. And as you can imagine, my family was thrown for a loop, kind of devastated. I turned to journaling. I turned to the page to process what was going on with Neil, what he had lost, how his whole world was changed as a senior in high school. What should have been the time of his life was not. My anger at the drunk driver for having caused all this. And also there was one aspect of it that left me feeling particularly lonely and isolated, which is termed in the psychiatry sphere as ambiguous loss or disenfranchised grief, in that I was the mother whose child did not die, right? So whenever I would talk about Neil's second surgery for his leg or his academic meeting to talk about learning accommodations, I would kind of be met with this either spoken or unspoken, but he's alive, right? And shouldn't I just be grateful is the feeling I came away from that with. And so the page became really important to me as a place a safe space that I could process all of this. And it was empowering for me. I couldn't change what had happened to our family, but I could kind of navigate it on the page. I could own my own story, tell my own story. on a page in a way I couldn't at the time with my friends and family. So it became a really powerful outlet and a powerful tool for me, which I revisited maybe 10 years ago, thinking about writing a book using writing as a tool for healing.
Thank you very much for that background. I'm struck by what you just said regarding anger in particular. I think that's a particularly difficult emotion to process in real time. It's also one that can be very counterproductive in real time. So, how did you find writing helped to address, diffuse, reframe anger? Because I think that is maybe the top thing that I found personally in my own life, that the anger is always still there against, there are certain doctors that I am very grateful to, of course, but there are others I'm very angry at still. How does writing help when anger is involved?
Yeah, so I think one thing it does is simply give it a vehicle, a vessel, a place to set it down. I think there are some powerful and important scientific studies that look at, for example, functional MRIs of people who are expressing strong negative emotions. And I think in psychiatry, they call it affect labeling, but just that externalizing of painful negative emotions has been shown to, in our brains, the brain regions that tend to activate with distress are deactivated when we are naming, externalizing painful negative emotions. So I think there's actually some science behind it. I've used it in other times in my life too, where when I've been angry, like you said, to just write a letter that never gets seen, never gets mailed, but it helps with taking perspective, keeping a sense of what's important, a sense of the bigger picture, and not get lost in the smallness, I guess, that anger can be. I agree. It is one of those emotions that it is probably the least helpful in terms of tapping into to heal. But like you said, if it is there, we need a place to lay it, to externalize it. And writing can be that place.
Yeah, thank you. That makes a lot of sense. And I will say one of the things I really enjoyed about your book was the way you incorporated some of the cutting edge research that's been done on how and why writing helps us and which areas of the brain indeed are engaged when we do certain types of writing activities or when we're feeling certain emotions and expressing them. So yeah, that's another reason why I was excited to talk to you, because I think it's really difficult to write an accessible book that also incorporates some fairly heavy duty scientific inquiry into all this. And I think you managed to do it with a light touch that is also very persuasive. So that's another reason why I want to recommend this book. Now, I'm also wondering, what motivated you to write this book now? With the people you talk to, like, we need help too, can find new ways of coping with burnout through writing. Like, and so I'd like to you delve into the prehistory of the book on that side of things, from your professional background.
Yeah, sure. So the book, it started out as a different iteration. It was always a book about using writing to heal, but I was a little fuzzy for quite some time on the exact audience. I thought at one point of directing the books towards women of a certain age, like myself, career path changing. I thought it could really help sort out some ambivalences. I thought about gearing it towards people who had suffered trauma and loss and grief, like my family had gone through. Ultimately, as I kept writing, I began to really focus on my ideal reader. And the exercise I used that helped to crystallize my audience for me was an exercise in which I was asked to describe my ideal writer, not my audience writ large, which is what most book proposals ask you to write about. Describe your audience and how you're going to reach them. This asked me to describe one ideal reader. And so I did that, and I found myself describing myself. I found myself describing a physician at the end, near end, mid to end of her career, really frustrated with insurance, telling her, what medication she could use or imaging studies she could or could not order, how many patients she could see, and so forth, and really ready to hang it up, and yet feeling like there was still a lot to give. I described, and, as I began to write about this person, I wrote about another person, and I wrote about a resident, or rather an early career attending, who had finished residency, finished fellowship, thought she had gotten through the hard part, it would get easier. And then there were teaching responsibilities, and then there was committee work. And she too was toying with the idea of, maybe I picked the wrong field and I can't quit. I have so much debt. And I realized this was before the pandemic, but burnout was starting to become an issue in medicine. And I realized that was my people. That was my audience. That was a group that I knew well, physicians and nurses. I had worked in a variety of fields as a doctor and a nurse, including the emergency room, including labor and delivery, ICU, primary care practice, solo practice. So I felt I had a good handle on that audience, and that, like you said, they could really use a tool. And it's a small tool, but it's sort of what I have to give, and it's what I have that worked for me that I wanted to share.
Carolyn,
Yeah.
sorry, Brett, I have a question, if you don't mind. Is that okay, Brett?
Oh, of course. Go right ahead.
The way you're talking, to me, it reflects that you see writing, that I'm sure you will talk more about how to write later in the podcast, but you see writing as a way to validate yourself, as a way to reframe your feelings, and many other items, I'm sure. But what I'm also hearing is a way to empower yourself to channel that energy, whether it's positive and or negative, in a way that allows you to act on it constructively to make your own life better, and maybe beyond that, healthcare better. The way you talk resonates a lot with me, and I looked it up, so I'm going to quote it here. I don't know if you're aware of the City of Hope, that has a gate when you enter their facilities that bears the words of the early City of Hope leader that says, that I'm quoting here, "There is no profit in the curing of the body if in the process we destroy the soul." And I think that resonates a lot with what you're trying to do.
Well, I think that resonates both with the concept of burnout and with writing itself, where we talk about damaging the soul. And my book is structured around Christina Maslach's 3 dimensions of burnout. I've heard her talk about burnout as an erosion of the soul. And I think that kind of gets at the moral injury that we sometimes come up against, where the values and beliefs that we came into medicine with are kind of butting up against the constraints of the work environment. For example, how much time we have to spend with patients. If that is curtailed, that feels like we're not giving of ourselves the way we were taught, the way we believe in, the way we want to. Even something as simple as prior authorization in insurance, where a medication or a formula is denied and we have to appeal, we have to write letters, we can have a phone-to-phone, peer-to-peer, doctor-to-doctor conversation about these medications or formulas, and they're still denied. So we have to kind of watch our patients suffer for that 30-day period, after which the insurance company will say, okay, that now we'll consider that a failure. And in the meantime, we both know that it's going to be a failure. And, find ourselves frustrated and angry that we're not allowed to make the decision to start the patient on this medication or formula earlier. So that feels that's like getting at the soul of medicine, the soul of us, our purpose, our meaning. But it's also something that writing is one of the things it's particularly good at, is getting down to that meaning, to that purpose, reconnecting us with purpose, cultivating the openness that we need to create that meaning or recognize meaning in a particular doctor-patient interaction or relationship or conversation. So it can be the erosion of the soul, can be the issue that writing is maybe most adept at helping us with.
Thank you, Carolyn. That's a wonderful answer. I'd like to maybe talk a little bit more, though, about like what are the symptoms of burnout from your point of view? Like, what does that really look like for people in the medical profession who are asking themselves, am I just really tired? Am I frustrated? Am I actually depressed? And what do people misunderstand maybe about burnout from your point of view?
Yeah, so maybe I'll start with Maslow's 3 dimensions that she outlines, which are one you mentioned, emotional exhaustion. And I think it's more than just fatigue, more than just being exhausted at the end of a busy day. It's more depleted. It's more like you have nothing left to give, right? And then there is the depersonalization, the cynicism that kind of slowly creeps into our work. And then there's the feeling that it doesn't matter, a feeling of a lack of personal accomplishment. It's not that we are not effective, but it's that we feel ineffective. We feel like we're doing the same things over and over again, and it's not getting us anywhere. And depressive symptoms can look like that, and that is important to distinguish. Burnout isn't in the DSM. It's not considered a mental illness, but depressive symptoms can be intertwined with that. Burnout is specifically occupation related, work related. So that's really important. And I think people will often think they're not there yet because they don't experience all those symptoms. And just recognizing that even if you're experiencing one, or even not every day or all day, but just, from time to time, you keep noticing that, geez, this is beyond the usual, I'm kind of exhausted here. And looking into changing something, looking into getting some help. There's been less stigmatization of getting help as a physician. It used to be that recredentialing and hospital applications would ask stigmatizing questions about mental illness, and that is beginning to change. So people should feel empowered to go ahead and reach out. And it's not always easy to recognize. So just getting help, just getting someone to bounce this off of is helpful. A colleague of mine, Jessie Gold, she is a psychiatrist. She wrote a book, and she's a chief wellness officer at the University of Tennessee. And she wrote a book called How Do You Feel? It's part memoir about her own experience with burnout and part prescriptive nonfiction book. It took her a while. It took her several chapters or several months or years to figure out what was happening with her, kind of acknowledging and labeling it as burnout. So I think you're not alone if you're thinking, do I have it? Do I not? Am I depressed? Am I just anxious? Or am I starting to burn out?
Thank you. My former wife, we're amicably divorced, but she wrote a book on caregiving and burnout
Oh, yeah.
in America. Her name's Kate Washington, and the book is titled Already Toast, Caregiving and Burnout in America. And
I reviewed her book, actually.
did you really? Oh,
Yeah.
it's a small world, isn't it? Well, I think one of the ways, she took an online test at one point to figure out, okay, how badly burned out am I? And there were a bunch of markers. And I seem to remember that compassion fatigue was a metric for burnout, right? And that would seem to be especially important in the medical profession, right? if you're unable to feel any compassion or less compassion for your patient, is that an especially concerning warning sign?
Yeah, and I think that's where the second dimension of the depersonalization and cynicism come in. And it's a real occupational hazard in this field, which is a giving profession, a caring profession, where we're asked to have empathy and compassion. We bear witness to suffering every day. And Rita Sharon, who directs the narrative medicine program at Columbia, she talks about doctors having a porousness that we must develop a permeability so that we can absorb these stories of illness that our patients tell us, which I agree with. It's really important to hear those stories, to take in those stories of illness, to understand the patient, where they're coming from, to get the diagnosis right, to get the treatment right. But in that process, I think what happens is that we continue to carry those stories, right? We walk through the rest of our day with the story and the suffering of the first patient we saw. And I think writing can really help be that filter through which we take in the story, but then release the suffering that belongs to the patient, that does not belong to us. And I think that's the key, because the filter can let go of the suffering, but also retain the meaning that we, as we're writing, as we're releasing this suffering, we can also look more deeply at the interaction, the conversation, and extract meaning as well while leaving the suffering on the page.
Did that also connect to the concept of openness? I'll frame my question in terms of my own experience. I've recently gotten much more involved in the cancer support space with a group called Man Up to Cancer, where it's an emotional support group for men who don't join other emotional support groups, basically at the same rate that women do. And I found that what that group has enabled me to do, in essence, was to share my story in a context where I'm hearing lots of other men sharing their cancer journeys, but being willing to open up and share my story again, I'm also willing to hear more of their stories and to be open to more of their experience and to be able to show compassion and support for them. In some ways, getting your own thoughts down on the page, I have found anyway, is a way to then refocus outward and say, okay, I'm ready for someone else to walk through the door and tell me about their difficulties too. Does that resonate with you in any way?
I think you can tell by the way I'm nodding this enthusiastically as you're speaking. But yeah, writing can, openness is one of the big 5 personality traits that they talk about, along with, introversion, neuroticism, conscientiousness, and I'm missing another one. But, you think, well, can you really cultivate a personality trait? Aren't you like born with these personality traits? And yes, and to a certain extent, they are inherent, but you can, and this has been scientifically shown, you can cultivate openness. And in medicine, that can be particularly helpful because we deal with a lot of uncertainty, as I'm sure both of you in your cancer journeys have had to deal with uncertainty. In medicine, if you don't tolerate ambiguity, as they talk about it, you can find yourself jumping to conclusions, jumping to a quick diagnosis just to have a diagnosis and not have this uncertainty or this working diagnosis kind of hanging over. We want answers. We want to close the case. We want to cut a patient off. If you don't have an openness, you can, studies have shown that we give a patient all of 11 seconds to speak before we're jumping in, saying what we think we know already before we even hear most of your story. And writing has been shown to be able to cultivate that openness so we can sit with that uncertainty. And like you mentioned, Brad, we can let in other stories. And getting back to your previous question and yours, Josie, about compassion and empathy, there's there's sort of two components to empathy: a cognitive empathy, where you understand intellectually what someone is going through. And then there's the emotional empathy, where you're actually asking me to feel what you feel, what you're going through. And that can drain us and contribute to burnout, whereas the cognitive empathy is actually protective against burnout.
Carolyn, you say so much. My head is going all over the place, and I can't wait to read your book. And so we should talk probably a little bit more about what is really in the book. But one thing you hit on, and I've received psychoanalytic training because I think that field is fascinating. And one of the biggest accomplishments in that field is to be able to tolerate the unknowns, the uncertainty, not having answers, being able to accept that, make peace with that. But when you started talking that way, that I started to associate to my own work when I used to work. One of the things that they did to prevent, reduce burnout is to work on our ability to tolerate more, making us providers feel like burnout is our problem, our failure. We're not coping well enough. But I think burnout is a much, much bigger picture. It's not the fault of the provider, it's not the fault of the caregiver. Wherever burnout occurs, it just means that there's an imbalance between what we're being asked to do and what we're capable of doing. And everybody has limits. And in capitalism, it's the pendulum. We try to put more on somebody's plate until they have reached their limits. And I think in society as a whole, we are reaching our limits.
Yeah, no, I do see what you're getting at in terms of just being overwhelmed by whatever it is that's being asked of us, whether it's in politics, everyday life, family life, or work. And I think that's the pushback people get when they are talking about resilience. And I think, the entities, the administrations, the organizations, the hospitals are beginning to understand that they need this system that needs to change, that they are recognizing and hiring wellness officers, instituting wellness curriculums. And I think when this first started, one of those curriculums was resilience workshops. And I think if you're sitting in a resilience workshop and you have 1 million patients and very little time to see them, it can feel like, why am I being asked to be resilient? Why aren't you the one changing my schedule so I can rest and recharge and so forth? And I do have a chapter on resilience in my book. And my point about that is that even if we are in an ideal practice environment, we still are bearing witness to suffering. There will still be adversity in our clinical practice every day. And so resilience, to me, is not how well I hold up to having one thing after another piled upon me, but it is also about what are my inner strengths. It's about creativity and flexibility and optimism and all of these other more positive aspects that we can bring to the table in finding solutions to these issues.
It's a problem that needs to be solved on multiple levels.
Yes.
Yeah, I'm glad that Josie addressed that kind of the systemic failures that are convincing us that it's our personal failures that we need to rectify. But yeah, I mean, I sort of do want to get back to the writing for clinicians who say, well, I'm not really a writer. How do you invite them in or motivate them to find that writer in themselves?
Sure. So that is one skepticism I run into a little bit. I'm not a writer, and I try in my writing workshops to kind of level the playing field right off the bat and say, we are none of us Shakespeare, And it truly doesn't matter. That is truly not what this is about. It's not about pretty prose. In fact, the guidelines are not to spell check, not to grammar check, not to let your pen move off the page. Just keep writing. And, the reflective writing practice that I describe in the book is an inherently self-compassionate practice because there is no right answer. There is no wrong answer. It is whatever the answer is for you today at this moment. And, whether you are an accomplished writer, a published author, or not, the beauty of writing is that it meets you where you are, right? It adapts to whatever it is that you bring to the page. So a lot of my workshops, I mean, some of them are just meant for physicians or healthcare professionals. Others have a very, very diverse audience. And it's sort of my job to lay those ground rules and to level that playing field. And writing inherently does that.
Oh, thank you. And this is a very self-serving question, so I apologize, but I have something that I think of as my magic prompt. So when I come to a group for the first time, I ask them to write about a transformative experience, but in the present tense and in the third person. So not, when I had my stem cell transplant, but when stem cells go in, he starts to feel sleepy or whatever. Reframing that experience, as happening right now, but to someone else is a sort of, I found it to be in my own writing practice, to be a wonderful way of getting at experiences that I had that I didn't know how to write about because I didn't have clear memories, for example, of the day that I got my brother's stem cells. I was drowsy. But reimagining that as when his brother's stem cells go in, I managed to write a poem. But do you have the magic prompt, or is there a particular exercise that you have found that helps people open up quickly in the way that you hope that they would? I'd love to get a magic recipe from you, Carolyn.
Yeah, I think before I get to any magic recipe, if I even have one, I think it's interesting you use the third person in that way. I hadn't really thought of using it in that way. The way I use it is to use third person to describe an event, a conversation from your own perspective, and then describe it from the person on the other end of the conversation to just kind of get their perspective taking, a different perspective taking, but to kind of use it as a way to put yourself in more of an observer position, and you can describe what may have been going on with yourself. Like if you didn't remember, as you say, I think that's a really interesting way to use third person. We do something similar in narrative medicine when we're doing not straight reflective writing, where we go right to the prompt, but we back up a little and use a piece of literature or art first, and we discuss the poem. That maybe accomplishes the same thing because we're sort of discussing it objectively. What did you think about the poem? What point of view is the poem? And, what does this metaphor mean? And, why is this person stopping here? What does this white space mean? So it gets us kind of talking as colleagues, as a group. It gets us to know each other so that when we get to the prompt, we're not just diving right in, okay, here, write about this. We've had a chance to kind of connect a personal or clinical experience of our own with a story that's happening on the page, with an objective story. So I agree with that piece of it. I kind of tried to do the same thing in a little bit different way. But so in my book, I have roughly 3 prompts for every chapter. So that's almost 100 prompts. And they generally form the same kind of pattern where I'll ask you first to simply describe a conversation or a situation or something that you want to examine. And we have usually chosen a theme, or I have chosen a theme based on whatever. In July, I might talk about transitions because new medical students are becoming interns, then fourth-year medical students are becoming residents, and so forth. Or the residents experience the death of a beloved patient. So we had a theme of grief. So I might construct a prompt based on that theme and ask us to relate it to the poem or artwork that we've just been discussing. And then I ask them just to describe it. And then we talk about our thoughts and feelings about it. And then the last thing is to look at, what can I learn from this? What lesson can I take? What practical wisdom can I glean from what happened? And that is the kind of third and final part of that. So that is where sometimes the magic happens, when you're thinking, oh, wow, I didn't realize I had that anxiety or that feeling of guilt. There's a lot of that self-awareness that pops up in writing.
So bring something to the level of consciousness.
That
Come
was there all along.
Yeah. I seem to recall that you use that reframing of point of view to get writers to reconsider moments when they themselves have closed down in the past, right? And by closed down, I'm assuming you mean where they stopped kind of listening to what someone was saying, and they had spent that 11 seconds, that you were talking about. Doctors will listen to their patients for only so long before they say the thing that they were going to say all along. The exercise that you kind of invite your readers to do is to go back to that moment of having closed down and then reframe and write from the other person's point of view. I seem to recall that it seemed a very useful way of trying to open people back up to those moments where they thought they had.
Yeah, that prompt came from the Buddhist nun Pema Chodron, who said in an interview, and I'm paraphrasing, something like, we will only begin to open when we recognize that we're closed. So that was trying to get someone to realize, like, when did you tune out? When did you kind of stop listening? And what might you have gained if you had remained open?
Yeah, I mean, I think, honestly, just speaking candidly, I think that's the hardest thing for me to do, is to try to find my own blind spots. That is the ultimate challenge. I don't mind reflecting on my own life, but finding my own blind spot is virtually impossible. I need other people to point it out to me as a rule.
And I talk about that in the self-awareness chapter, that self-awareness is kind of built over time from when we're very small. And, some of that is just everyday lessons learned. Like my dad would call it the school of hard knocks, like what you learned about yourself just going through life. But some of it is what feedback you get. And, that can be feedback from a job interview, but it can be feedback from, a family member. I remember I'm the one who does Thanksgiving, the last, I don't know, 10 years. And I remember cooking and preparing and making an offhand comment to my sister-in-law that, gee, maybe I'm not the go with the flow kind of person I like to think I am. And she said, "You think?" And I was really taken aback, because I kind of did think of myself as a easygoing, go with the flow kind of person, but clearly everyone else knew that I was not. So I think you're right, Brad. You do have your blind spots that you need pointed out to you.
Yeah, I certainly agree with you, and that's a very funny anecdote. And thank you for sharing that. I guess I also wanted to ask a little bit about the reframing in the terms of practical wisdom, like lessons learned. One of the writing workshops that I facilitate, we always ask people, after they've written expressively about their feelings, to then turn and write a piece of advice to someone who's in a similar situation, right? And that is a way of sort of reframing the experience in terms of, here's what I learned and here's what I can offer you by way of wisdom. That seems to be it seems like it ought to be particularly beneficial in a medical profession where I would hope and assume that there's still a lot of mentoring that goes on between junior physicians and older, more experienced physicians. But I'm wondering if you see writing as having any role in that ongoing sort of sharing of advice and practical wisdom where it comes to burnout questions.
Yeah, and I think that reframing is really important. We use in psychology and psychiatry, they use writing. They talk about trauma narratives that they have, people who have experienced trauma or maybe having PTSD symptoms. They advise the client to start writing it out, and then reading it aloud. And I think one way that helps is just it loses its power to hurt you, to harm you. The more you kind of sit with it, write it, read it. And another way that trauma narratives can be helpful is, like you said, Josie, reframing, or you said, Brad, like finding advice or finding the positive in the adversity. And I think that's a great exercise and a great way to get at that. Like if you can't see it for yourself, to ask you to advise someone else or write a letter to someone else and give them advice. Because I think one thing, it's true in medicine, and it may be true in general, is that we seem to have an easier time having compassion for other people than we do having self-compassion. So I think framing it in that way, what would you tell someone else? I'll often have someone write a letter to their younger selves and just turning it, making it almost a pretend point of view, third person point of view exercise. Just makes it a little easier. That difficulty giving ourselves compassion can be overcome with that third person.
Yeah, the current generation of medical students, for them learning to write and take a breath and sit with a cup of coffee or tea and write this letter to your future self during medical school, to get into the habit early on so that they hopefully will take it with them as they grow in their career.
Yeah, that's interesting that you say that, Josie. My friend Suzanne Colvin, she is the writer in residence at Mass General, and she published I guess you would call it a memoir in essays called Letter to a Young Female Physician. And that, I can see you've read it, the way you're nodding enthusiastically. That book started when she was in her role as the writer in residence. She was addressing a room full of interns, and she assigned them this very assignment that you just mentioned: write a letter to your future self. And as she was looking over this room full of young doctors, most of whom I think were women at this point, which is very different from her early career, she was very moved watching them all, scribbling attentively. And she decided to, while they were writing to their future selves, she decided to write a letter to her younger self. And that, she had only given them 5 or 10 minutes, and that essay, she kept working on it and published it in the New England Journal of Medicine, and it kind of went viral. And that's when she decided to write a book. So you're right when you're saying this can be a powerful tool, this writing a letter to our future selves, to our past selves.
Thank you. Sort of on that same theme, what are some other, episodes that you've encountered of people writing in either one of your workshops or in a similar workshop, like, medical staff writing? What tends to surface in those folks? Like, what emotions do they uncover that they might not have otherwise found? And I'll share that, in the support group that I am part of, Man Up to Cancer, there's a lot of survivor guilt of, people who are like, well, why did I survive and my buddy didn't make it? And, I'm sure doctors have seen a lot of deaths too. Anyway, but I will not, I will try not to preempt the answer any further. But yeah, like what types of feelings tend to surface in your experience? when medical people start writing along these lines?
Yeah. One thing I have seen, I mean, there is what I mentioned before, wow, I never knew I felt that way before. I did a workshop for brain injury survivors, and there was one who said her wow was, wow, I guess I'm actually grateful for my brain injury. I, I've never thought about it that way, but I think I really see that now. So that was one thing. There's also, frustrations come out, senses of helplessness come out as, you know, and I felt this way caring for my son after his brain injury. As a doctor, we're programmed to heal, we cure, we take away pain. And, when you can't do any of that, you feel less than, you know? So a lot of that comes out. But interestingly, what can also come out of those pieces of writing, if the workshop includes sharing, is a reframing from another person's point of view and realizing that there are other roles for physicians. There can be an advocacy role that maybe you didn't realize was an option for you, was there for you. Or there's a simple bearing witness role. Like maybe you don't have the answer or the cure for the patient. Maybe no one does, but your presence is still valuable. And that has come up in various situations as well.
Thank you. And Carolyn, maybe a final question here. Going back to your book, the title or subtitle is Restorative Writing for Healthcare Professionals. What does restoration look like in that title? Not just relief, maybe, but sort of reconnection in some way. What is your definition of restoration? And what, by extension, then, would be the thing that you would want the reader of this book to take from your book along those lines?
Yeah, I think it is that connection, that engagement, that being open. You know, I don't know if you're familiar. This just came out a few months ago, or maybe it was a year ago, but it's maybe a few months ago. Um, a study out of the University of Michigan on sacred moments. Sanjay Saint and his group asked over 600 internists, internal medicine physicians, whether and how often they had experienced sacred moments with their patients. And by that, they described the sacred moment as a brief period of meaningful connection with a patient. And over 2/3 of internists said, yes, I know what you're talking about. I have had that moment. And the follow-up question, which it interested me even more, was, have you shared that with your colleague? And the overwhelming answer there was no. And I think, right. And I think that's another place where writing can be helpful, is to name and normalize these sacred moments and to open us to them, to make room for them, to have us be open to the possibility of them, to the recognition of them, to the creation of them. So I think that engagement and that openness is what I would hope for my readers. And I think also, we say health is more than just the absence of disease. And I think in medicine, wellness in physicians is more than just the absence of burnout. And what I strive for in this book is for readers of it to actually flourish. The book begins with stress and what is it doing to our bodies, and bearing witness and vicarious trauma and secondary suffering. But it moves us to the end of the book. We're talking about wonder and awe and joy and optimism and creativity and flourishing. So that is my hope for the readers of the book. And that is the transformational journey I'm trying to bring writers on through this book.
Well, I think, from my perspective, you are well on your way to accomplishing that. In fact, I've already recommended your book to staff of the Roswell Park Cancer Center, for whom I do writing workshops on a monthly basis. One of the things that I've tried to do is I've tried to reach out to cancer centers to see if I could do writing workshops for their patients, but it's difficult actually to get access to the patients. So I'm doing it for the staff instead because they need it too. And I certainly think they can benefit from your book as well, Carolyn. So, but yeah, hopefully, maybe they'll reach out to you and do an in-person workshop one of these days. Who knows? But yeah, I strongly recommend a prescription for burnout, which is, not a prescription that will get people burned out. It's, a way to address burnout, of course.
Thank you so much.
Thank you both, Carolyn and Brett. And remember, the relevant links will be in the show notes for topics and references we spoke about. I thought this was very enlightening. It was very touching to me, Carolyn. I thank you for taking the time with your publication day to sit down with us, and please keep writing.
Well, thank you. It's my pleasure. Thank you, Josie. Thank you, Brad.
Yeah, thank you so much, Carolyn. It was wonderful to chat with you.